So let's get into understanding Hashimoto's thyroiditis. It is the most common autoimmune condition, the most common cause of thyroid failure, and is the most common cause of endocrine dysfunction. And it is due to a chronic inflammation. The word chronic is important because inflammation is redness, swelling, and pain, whereas chronic thyroid inflammation is a painless condition. What does autoimmunity mean? Auto means self, immunity means protection. So when the body is trying to protect itself against itself, it leads to self-destruction like a friendly fire, causing personal devastation. One has to have a genetic susceptibility, so it runs in families. Usually there's a stressor that upsets the adrenal system, and your adrenal system is your stress management system. It produces the hormone cortisol when there's chronic stressor. Now, cortisol stimulates your immune system, trying to help you fight something that it does not want. However, there are two types of soldiers we're going to talk about. The soldiers who do the fight, they're called the antibodies, and there are other cells that actually contain the fight. So you say if you have two people fighting, the fight can get out of control, or they can fight for a long time unless someone comes and intervenes and makes peace. So there are two types of antibodies again. One is the soldiers that fight the infection, and there are other soldiers or cells that suppress the fight and try to contain it. Now, these suppressing cells are inhibited. In other words, they don't work as well, so the fight continues a little longer than it should. So there is chronic inflammation that results. Now, very interestingly, they also find when there is a stress involved and increase in cortisol, there is an alteration in the bacteria in our gut. So let's talk a little more about this autoimmune condition. It was discovered by Dr. Hikaru Hashimoto, who discovered this as a new problem within the thyroid. It used to be that 1 in 1,000 women used to get it. Now we have 46 in 1,000 who get it, so about 5% of the women population are affected by it. It affects women particularly in the 40s to 50s. We talk so much about women and thyroid because 8 out of the 10 Hashimoto's are usually in women. There are men who do get affected by it. There are 6 types of Hashimoto's. You have the classic, the fibrous, the IG4 variant, the juvenile, the hashitoxicosis, and the painless postpartum thyroiditis. And we'll get into that in a minute in the next video.